Welcome to this edition of Rattling the Bars. I'm Mance Musa, your host. Carla Nelson is currently the Chief Operating Officer at True North Recovery and a governor-appointed board member of the Alaska Advisory Board on Alcoholism and Drug Addiction. Since 2016, Carla has served as a chaplain for the Alaska Department of Corrections. Welcome to Rattling the Bars, Carla.
Thank you. It's such an honor to be here.
I just gave a brief overview of some of the things. Tell our audience a little bit about yourself.
Sure. Well, like mentioned, I'm the Chief Operating Officer here at True North Recovery. But I started out after 20 years of active addiction in and out of prison. It was about 20 years there. My last release was 2011. At that time, I started a nonprofit, a home for women coming home after incarceration, and really was a launching pad for a lot of advocacy and people speaking out that one had a desire to live a recovery pathway, but also people that had been formerly incarcerated, family members, and just a space that hadn't been done before. So that has really started me on this trek of how I got to where I'm at. And I've been involved with True North from the beginning. One of my best friends is the CEO. And I say that because he also was incarcerated. We have 100 employees. I would say about 95% of us have some kind of lived experience as well as our professional experience, which gives us unique ability for that innovative way of reimagining behavioral health, how we do it.
All right, look, let's talk about, as I was talking to you earlier about Alaska, and for most people, unless you live in Alaska, visit it, or have some type of tourist association with it, our general information comes from discovery. And in that regard, we often think of Alaska as wilderness. We often think of Alaska as people that are, more nature-driven. We don't think of Alaska as a place where people will have a substance abuse problem. We don't think of Alaska as a place where you have people going to prison or what a prison look like in Alaska. It'd be a stretch of our imagination. Talk about, in the face of what's going on in society today, mainly with drug addiction. You have, I'm from the District of Columbia. I'm in this region. You have a fentanyl overdose. You have the legalization of marijuana, and at the same token, it's been decriminalized in terms of your possession of it, but it's not decriminalized in terms of you do something with it in your system and cause something to happen that you're going to be charged appropriately. Talk about the recovery effort that y'all are doing down there in Alaska or up there in Alaska. Talk about y'all program and some of the things that y'all are doing and why you think this is important work in Alaska.
Well, it's incredibly impactful. One, Alaska is very different than anywhere else. And so a lot of the different programs and initiatives don't work the same here just because Alaska is huge and people were spread out all over the place. And so, for instance, also when we have substances brought into our state, they're either brought in by plane or boat. And so there's federal issues and charges that are associated with that. It's hard to get the support you need. People live in very remote areas. We have 750,000 people that live in Alaska, and almost 400,000 of those live in one city in Anchorage, about 45 minutes from where I'm at right now. And so it's just very difficult. We have the same issues as across the country, and the challenges are heightened because of just lack of access. We're usually pretty behind when it comes to being innovative or having those resources and changing the landscape of either how we provide treatment, or especially I'm very passionate about programs and really getting inside the prisons, making sure that everyone has equal access to mental health and substance use treatment and rehabilitation. So that's also very unique because the prisons are a long ways away from your home. So there isn't that connectivity. There's just we also, because it's so dark here in the wintertime, the depression levels and suicide rates are extremely high. Last year we were first in the country. I'm not quite sure what the numbers are this year for suicide as well as domestic violence, which of course all are in that continuum of getting into prison and really utilizing substances to survive. And it's what works and what doesn't work. So, yeah.
Right, I got you. So how many, if you know, how many prisons exist in Alaska?
So it's a unified prison system. We have 12 prisons, and then there's lots of holding facilities. So you have these small communities, and honestly, they call them holding facilities, but people could stay there for a very lengthy period of time. We have one women's prison, which is in Anchorage. And so if you live anywhere in the state, you get sent to the women's prison. You're so far away from your family. Also, we work really hard with DOC to really have the programming inside for treatment, especially mental health and substance use disorder. But what happens is they only have it in one institution. Maybe 5 people can fit into the boxes to check, and then it's portrayed as it's happening across the state. So that's something that we work on to eliminate and have access to care.
Are y'all, in terms of the organization True North Recovery, I was looking at some of the things that y'all doing on the web page, but talk about how long y'all been in existence, and what are some of the things that you're doing both outside in society, and if y'all have any inroads in dealing with anything within the correction system.
So True North Recovery was founded in 2016, but prior to that, it was just 2 guys who were tired of seeing their friends die. And I was friends with them. And so I was also doing that in the nonprofit I mentioned earlier, the Home for Women and Programming for Women. And so we just took it upon ourselves because we were trying to make a change, yet all the different treatment facilities and behavioral health systems, there were so many barriers. You couldn't even get an assessment to get in for months out. So one of the things that, one of the many things that we, is part of our heart is same-day access to services. So it started out as a peer support network, and different treatment centers would contract us to do peer support. And at the time it wasn't talked about like it is now. People didn't talk about going to prisons, people didn't talk about their recovery. And so it really started out there, and they saw the impact of that lived experience with others in a way that they couldn't hear it when we were trying to advocate for, but when they actually saw it working, and just the success stories. And even if people didn't live an abstinence-based life, their quality of life changed.
Right.
So the state of Alaska actually approached, at the time, it was called Fiend to Clean, was what it was called in the beginning.
Right.
And the state of Alaska actually approached us and said, hey, we actually want to fund you to start a nonprofit. And we called it True North. And that was in 2016. I'm pretty sure it's the only time a state has preloaded crazy kids who were just trying to save lives at the time. And so since then, we started as an outpatient program with peer support is across the board. We don't add peer support into our programs. We are peers.
Right.
We add the clinical aspects and the other aspects into that. So we started out as outpatient. It grew tremendously because, of course, in the beginning, we were just people that people could relate to. So we would have so many messages coming in. And again, I didn't technically work for True North, but we were in a tight little network across the state making this happen. So we went from there to opening an inpatient treatment center. And It's a 10,000 square foot beautiful home.
Mm-hmm.
So everything we do is very personalized. It's not an institution. If you walked into our treatment center, it's very home-like, very comfortable. Everyone that works inside that building does have lived experience. We have everyone from our master clinician to our intake people. And of course, that comes with working with the prison system and trying to do bed-to-bed transfers and really building those relationships. Mind you, it's a small state. We've all had interactions with criminal justice.
Right.
So just developing all those relationships and recognizing that it's not always policy that will change things, right? We want to get in, build relationships, and then change culture within the probation system, change culture within the prison system, judges, prosecutors. So now we have inpatient, we're opening another inpatient treatment facility up north in Fairbanks.
Okay.
Have a lot of very extensive reentry case management. We go inside before, and then of course during, lots of bail hearings. We have a walk-in crisis center. We do a mobile crisis team. Again, all utilizing people with lived experience.
Right.
Go on the streets with the mental health clinician up here, developing relationships with law enforcement so they don't have to go to the ER, they don't have to go to prison, they're not going to get arrested. When we can build that trust and have them call our mobile crisis team and go de-escalate a situation.
Right. And from what I'm seeing, from what I'm gathering, right, y'all heavy on recognizing that when we talk about substance use disorder or alcohol use disorder, y'all seem like y'all got the model that most people are adopting there in the country that's learned, is that it's more about mental health than it is about criminal behavior. Is that a correct analysis?
Absolutely. I mean,
and in terms, go ahead, excuse me.
We just can't incarcerate our way out of these complex social issues. So it's been a long process, but we're at a great place now where we're building foundations to really do away with those old ideas. Mind you, like I said, we had to do it first to show.
Right.
This is evidence-based when you actually support someone, when you actually come surround them and not punish them for acting on their illness, and let us do the work. You don't have to do it. We'll do it.
Yeah. That's right. And I think that in terms of, I heard you say y'all had got funding for True North recovery. In terms of y'all relationship with the Department of Correction, and more importantly, how or the court system, how are y'all able to impact on both to get them to recognize that it's a mental health, and therefore the way to deal with it is be more treatment orientated as opposed to carceral? Have y'all been able to make real inroads in that regard?
We have. I mean, it's person by person. So also like making it clear we don't work for you, but we are going to have the minimal contact that we can. So I'm talking about like judges. If someone, let's say they get a bail hearing and they get a bed-to-bed to our facility, we want to make sure they trust what we're doing, but we're also holding the line of that confidentiality and HIPAA. And also a lot of times they don't want to do that because in their mind, they're like, these are pre-sentenced people. They're probably going to go to prison for years, possibly. Why would we let them out for treatment? And so we're really good at explaining and educating that even if they did end up doing some time, there's a ton of drugs and situations and the culture inside the prison that we're also working on, but we're not there yet. And so there's so many people that have died by overdose and suicide, especially in our Alaska prisons in the last 2 years. It's tripled without having that treatment and rehabilitation inside.
And I think, I did left in my own time in prison, and I seen, firsthand, like substance abuse, substance use in prison. And I used to be a part of NA. I was real instrumental in being a part of that organization in terms of the fellowship and trying to get other men within the prison population you know, to deal with this disease of addiction, or to deal with whatever was going on with them that causes them to revert to substance use disorder. And I noticed that in terms of, as of late, the courts in this area have started accepting the model of it's mental as opposed to criminal, and they have been inclined to send people to drug program. Is y'all program being utilized by the court as referral?
So we are not specifically, but again, it's a small state, and
Right.
what we're doing. There are certain treatment centers that have contracts with DOC, and we do that in the place that we're about to. We just started services, and we will, because we're such a young company, and I think people are trying to check us out, like, because we've grown so fast.
Right. Right.
Kind of wait around for permission or fundage. We know that the best thing is to get people either into treatment or the right level of care, immediately. We do have drug courts here. We do have, again, they're so different across the board.
Right.
In one city in Alaska, mind you, we have to fly. We don't just drive city to city. I mean,
Right.
you do in the interior. And so it's really an education piece on, one, letting them know that we are available and we will take folks.
Right.
And there's just a lot of archaic mindsets still, unless you're in the main area, which is like Anchorage. They're pretty open about that.
How
We
do
go into prisons all the time and give education. And
how do people that have substance use disorder problems, how do they can they just walk into y'all organization if they don't have no insurance, or do they have to have some type of insurance in order to receive the treatment that y'all offering?
so we're a Medicaid. We take Medicaid, and if you don't have Medicaid, we will either help you get that. If you don't qualify for Medicaid, we're not going to turn anyone away.
Right.
This morning, I had a guy, and it's just different situations where we do a sliding scale fee, but also we have scholarships, because I mean, it could mean many different things, even if someone has an income. And so again, because we've all walked through it ourselves, I've been through every program you can imagine.
Yeah.
Years of active addiction and out of prisons. And so those are how our lens of our decision making is made. Obviously, we stay in the regulations for the state, yet also we're always challenging them and really showing them, like, I know this is how you've always done it, but here's what we've done, and it works, and people are actually getting well.
And in terms of the families, like women that are suffering from substance use disorder, they have children, have y'all been confronted with them situations where, and how do y'all navigate that particular? And I know that's a real hard situation, because for a person I'm a recovering addict myself, and made some bad decisions that ultimately led to some relationships that to the days I'm having problems repairing. How do y'all deal with them type of situations?
Well, we don't, you can't have children while you're in our facility.
Okay.
But one of the many great things why I work here is because we have so many extensive partnerships. So we know we can't do everything.
Right.
Not just partnerships like, oh, call this person. These are people we personally have a relationship with. And I mean, honestly, we have a list of folks, who we know that we know. A lot of times we'll even do an MOU with them to have that partnership solidified, even if it's just, hey, we're going to partner with you. And anytime your case manager or peer calls or whoever it is, we're going to make sure that it's given the attention it needs in the appropriate time frame. So like our walk-in services, we have people walk in all day long. We're referring and helping them to other treatment centers, not just ours. We just want them to get where they need.
Right.
But the family, women and family, I have 3 kids. I'm very passionate about women, especially women incarcerated, and the unique complexities of that, and just the trauma. And, I mean, I've experienced myself. It's something that I'm very passionate about, is women and children. My kids are adults now. We're still walking through that restoration
Right,
journey,
right,
even
right,
out 20
right.
years.
And in terms of I noticed you're chaplain in the Department of Correction. In terms of your involvement in institutions, and I'm quite sure you see a lot of things that goes on in this environment. And people have, when you ain't been in this space, trust is like is hard to come by. But when people see you have a commonality, they tend to trust you
Yeah.
more than they would not if they know it's a commonality and it's a no judgment zone. What impact are you having in terms of like in the prison? Is your organization involved in like trying to do some things within the prisons to create support groups, network, and peer type activities within the Alaskan prison system?
So our organization doesn't necessarily do that, except for going in to share what our resources are and and really give them that avenue to connect with someone. But they support me in all my craziness. So anytime it's very important to me to go, and especially now. I moved up here just a couple of years ago, and so I'm very close to our women's prison now. I can
Right.
30 minutes away from here. So, and I've been in all the prisons. As someone who's formerly incarcerated in the beginning, I mean, it was unheard of for someone like me to be able to go back in, still on felony probation, and do prison ministry. I was able to do that, and now it's opened up doors for others, because it used to be like you had to be off paper for 5 years.
Yeah, right.
And so I had the state chaplain come and he's like, how are you getting into my institutions, And I mean, it was just building relationship. And they saw, again, I would have COs calling me like, hey, we're having a ruckus, and J-Dorm, and can you come down and talk to these ladies?
Right.
I think it really is that power of having people with lived experience. Like you said, I mean, even if I didn't have the same experience as you, there's an instant trust even coming on this show, talking to you.
Right.
Because I know where you come from to some degree. And, it's very impactful. My dad is actually the chaplain at a prison here in Alaska. He didn't want anything to do with me during my addiction or anything to do with me while I was in prison. I never had one visitor. They had my children, and his heart was changed to the point where now he would be in the prison all day long, because there's such an impact that can be made there to really lift people into who they were created to be.
Yeah.
And I utilize that time as well to really speak into some of the justice parts, or people sharing their story, their testimony, how powerful that is, and bringing all that ugliness to light to make change.
Right,
in a
right.
very powerful way.
Right, thank you. And you have the last word. What do you want to tell our audience about Alaska and more importantly, True North Recovery and some of the works that you're doing and going forward?
Mm-hmm. I guess one of the people with lived experience can see through a lens of the professional, the regulations. It doesn't have to be difficult. We just opened a detox center. So when you want to do something and there's something that's a need in your community, it's not as complicated as you're making it out to be. And having that lens is more powerful than you can imagine. So we have all the degrees and all the professionalism and all of those things, but what makes us most powerful and impactful and change makers is because we have a lens of walking through it ourselves and allowing for it to go forward, and not being afraid, just taking risks. Your story is powerful. You are powerful beyond belief, whether that's in a personal or professional realm. Right. To say I'm the COO of one of the largest, treatment centers in the state of Alaska, I mean, it's all because of the experience I went through.
That's right. And how do our audience get in touch with you, and if they want to become more involved with
Sure. I mean, you can
True
email me at
North Recovery.
Kara, Kara at tnrak.org.
Hmm.
And
Okay.
our website as well, which needs to be updated, but the basics are there.
All right, thank you, Carl. And there you have it, the real news and Rattling the Bars. True North Recovery in Alaska, you might say. True
Yes,
North Recovery. Kyra is well spoken in terms of understanding the disease of addiction. She's well versed in understanding how to help people navigate their way out of this. And we ask that you continue to support Rattling the Bars and the real news because only from this mechanism that you're going to get information like True North Recovery as it relates to helping people rebuild their lives. As she spoke, it's people that will live experience are better situated to help other people with live experience. So we ask you to continue to support Rattling the Bars and the real news. Thank you very much, Kyra Nelson. Appreciate your taking this time out to enlighten us and educate us on some of the work that you're doing in Alaska and hope that you continue to make progress. And we look forward to seeing you back on our show in the near future.
absolutely. Thank you.
Thank you so much for watching the Real News Network, where we lift up the voices, stories, and struggles that you care about most. And we need your help to keep doing this work, so please tap your screen now, subscribe, and donate to the Real News Network. Solidarity forever.